For what purpose does the gentleman from Texas seek recognition?
Madam Speaker, by the direction on the Committee on Rules, I call up House Resolution 724 and ask for its immediate consideration.
The clerk will report the resolution.
House Calendar number 144, House Resolution 724. Resolved that upon adoption of this resolution, it shall be in order to consider in the House the bill, H.R. 6079, to repeal the Patient Protection and Affordable Care Act and healthcare-related provisions in the Healthcare and Education Reconciliation Act of 2010. All points of order against consideration of the bill are waived. The bill shall be considered as read. All points of order against provisions in the bill are waived. The previous question shall be considered as ordered on the bill, and any amendment thereto to final passage without intervening motion, except one, 5 hours of debate, with 30 minutes equally divided and controlled by the Majority Leader and Minority Leader or their respective designees. 60 minutes equally divided and controlled by the Chair and Ranking Minority Member of the Committee on Education and the Workforce. 60 minutes equally divided and controlled by the Chair and Ranking Minority Member of the Committee on Energy and Commerce. 60 minutes equally divided and controlled by the Chair and Ranking Minority Member of the Committee on Ways and Means. 30 minutes equally divided and controlled by the Chair and Ranking Minority Member of the Committee on the Budget. 30 minutes equally divided and controlled by the Chair and Ranking Minority Member of the Committee on the Judiciary, and 30 minutes equally divided and controlled by the Chair and Ranking Minority Member of the Committee on Small Business, and 2, one motion to recommit.
Members are advised to take their conversations off the floor. The gentleman from Texas is recognized for 1 hour.
Thank you, Madam Speaker. For the purpose of the debate only, I yield the customary 30 minutes to my friend, the gentlewoman from Fairpoint, New York, and the Ranking Committee and Committee on Rules, Mrs. Slaughter, pending which I yield myself such time as I may consume.
The gentleman is recognized.
During consideration of this resolution, all times yield for the purpose of the debate only. Madam Speaker, the House is not in order.
The House will be in order so the gentleman can be heard. Members are advised to take their conversations off the floor so the gentleman can be heard. The gentleman is recognized.
Thank you, Madam Speaker. Madam Speaker, I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks.
Without objection.
House Resolution 724 provides a closed rule for consideration of H.R. 6079. Madam Speaker, today I rise in support of this rule and the underlying bill, H.R. 6079, the Repeal Obamacare Act of 2012, which was introduced by the Republican Majority Leader Eric Cantor, the gentleman from Virginia. The bill text has been online since last Thursday, giving members more than the mandatory 3 days to read and to understand the language. Madam Speaker, on June the 28th, just 12 days ago, the United States Supreme Court upheld the individual mandate provisions in Obamacare, thereby forcing every American to purchase health insurance. And while I may disagree with how they ruled, I respect their decision, and there is nothing we can do to change that. Obamacare is now the official law of the land. However, there is something this body can do to reverse the course and to prevent the job-destroying aspects of this bill from taking effect. A complete repeal of the bill that the President asked this Congress to pass under Speaker Pelosi, and they did. We need to repeal Obamacare today. In 2010, Republicans were elected all across this country because Americans understood the need to stop the tax and spend policies of the other party, and H.R. 6079 will do exactly that. Last night in the Rules Committee, my colleague, the gentleman from New Jersey, my friend Mr. Andrews, urged us to, and I quote, dispassionately examine the facts, end of quote. I agree with just that sentiment and would like to take a moment to do just that. Earlier this year, the Centers for Medicare and Medicaid, CMS, reported that health insurance premiums are expected to rise by over 44% over the next 9 years as a result of Obamacare. And since Obamacare was signed into law, there's been a steady decline in the number of Americans on private health insurance. A report from the McKinsey Group found that more than 50% of employers had a high awareness of the law, and they said that they would stop offering health insurance, confirming what Republicans have been saying for 3 years, and that is that Obamacare is designed to force employers to drop coverage in an attempt to get Americans to enter the new health care exchanges. Madam Speaker, I ask unanimous consent to include a Wall Street Journal article on this report
Without
for
objection.
the record. A Kaiser Family Foundation report found that health insurance premiums have increased by 9%, or $1,200 for the average American family following passage of the President's health care bill. Madam Speaker, I ask unanimous consent to place that report in the record.
Without objection.
According to a 2010 Medicare Trustees report, as a direct result of Obamacare, more than 90% of seniors will lose the retiree prescription drug coverage they have and will see nearly double-digit premium increases. Madam Speaker, I ask unanimous consent to include that article into the
Without
record.
objection.
Seniors will also see reduced access to doctors, as Medicare officials explained, and I quote, that physicians could find it difficult to remain profitable and might end their participation in the program, which possibly could jeopardize access to care for beneficiaries, end of quote. According to the President's own budget, the cost of Obamacare subsidies have jumped $111 billion in just 1 year. Earlier this year, during a Ways and Means Committee hearing on February 28, 2012, when asked why this happened, Health and Human Services Secretary Sebelius said, "I really don't know." And finally, earlier this year, the nonpartisan Congressional Budget Office adjusted their long-term outlook of the impact of Obamacare on our national debt. The revised figures show Obamacare will cost taxpayers $1,800 billion, twice as much as the President promised in 2010 when the bill was passed. These are just a few of the facts that I believe should be considered dispassionately as we debate whether to repeal Obamacare. If you think that the facts I just listed are what the country needs, vote to keep it. However, if you, like me, find these facts unacceptable for our future, then I urge you to join me in repealing Obamacare so that we can focus on patient-centered health care solutions which do not increase dramatically insurance premiums, do not restrict access to physicians, and do not mount unsustainable debt to our children and grandchildren, as well as harming employers who wish to employ more Americans. I urge my colleagues to vote for this rule and the underlying bill, and I reserve the balance of my time.
The gentleman reserves. The gentlelady from New York is recognized.
Thank you very much, Madam Speaker, and I thank the gentleman for yielding me the customary 30 minutes and yield myself such time as I may consume.
Without objection.
Madam Speaker, I guess I better start by saying that one man's facts are another woman's folly. I want everybody who's listening today to clear their minds of what they just heard. And also to remind them that when Medicare and Social Security were also before the Congress of the United States, Republicans didn't like them either, and almost all of them voted against it. So to hear people whose plan for Medicare is to simply do away with it and give vouchers to the Medicare recipients, no matter what their physical condition or their mental condition, to go into the private market and try to buy insurance if they can with an amount of money that may not even cover it. This crying about Medicare in this bill, which really strengthens it, is hard to take. This is an incredible milestone today, and those of you in the gallery are here on a very important day. Over this last 2 years, over 30 votes have been taken on this health care bill alone. Today is the 31st. They want to defund or dismantle or do whatever to it. Never in the history of this Congress, and I feel perfectly secure in saying this, has anybody voted this many times on a single issue. And why? Because we don't have anything else to do. We are here simply killing time because everybody knows the Senate has already done away with this bill, so we know it's never going to become law. What it's going to do is, as I said yesterday at the Rules Committee, we're not trying to make law here, we're making political points. And that is a shame, because it's not that the country doesn't need our attention. It isn't as though the unemployment rate isn't so high and that people's futures are not so grim that they're crying out for us to get something done, but it has been said that this is the least productive Congress since the beginning of Congresses. It probably goes back to the Continental Congress. So here today, no jobs bills have passed here. And over that time, while everybody's clamoring for it, we do the 31st vote on this measure, which, again, everybody knows is going nowhere. So we have just months left in the 112th Congress, and yet we vote again on this. We voted at least 9 times on women's reproductive health, which shows you what really issues are here that people care about. Sadly, we're not going to be able to vote this year, the rest of this term, on creating jobs or rebuilding the infrastructure or even end the war in Afghanistan. But we vote for the 31st time on dismantling historic health care concerns. I am sure that while time runs out on this Congress to tackle the major issues that face us, to create jobs and to rebuild our country, we have failed to answer the call. I should say we, because that's the polite way to do it on the floor of the House, but everybody knows who's wasting time. This year, thanks to the Affordable Health Care Act, already more than 360,000 small businesses are expected to receive the tax credits that reduce the cost of health care for their employees. And meanwhile, the new guarantees one that ensures that the insurance companies will spend 85% of the cost on health care. Of your premium dollar, for the first time in history, 85 cents of that dollar is going to go to health care, not administrative costs, not being put away in something or building buildings or whatever else. It will go to health care. That in itself is going to reduce the cost. This increased efficiency is very good news, not only for small business owners, but for all the rest of us who bear the burden of inefficient care. In addition, more than 3 million young adults are already insured on their parents' health care, and more than 5 million seniors have cheaper prescription drugs simply thanks to this health care reform, and we have not even started. It is not going to go into full effect until 2014, which I deplore, but nonetheless, that's where we are. But despite these benefits for the millions of Americans, the majority wants to take it all away. Now, they talk about let's repeal and replace. With what? We've had no plan of replacement. There's no answer to what's going to happen to the seniors and others who are already benefiting from this plan. They have offered no solution of their own. And 537 days ago, the majority passed legislation requiring this Congress to craft a proposal that would keep the popular provisions of the Affordable Health Care, such as health care for people with pre-existing conditions. I hope everybody understands that your health care, as it is written now, has a yearly limit and a lifetime limit. If you exceed the lifetime limit, you are not insurable again in the United States, and you can do that fairly easily with, let's say, a serious head wound, other trauma. But we've waited for a year for this bill that was promised 537 days ago. I really believe, and I don't want to be cynical, but I certainly do believe, because I must, that no such bill will ever come. So what's going to happen if this bill passes and the Affordable Care Act is repealed? What's going to happen to the millions of women who will once again be charged more money than men for the same health insurance coverage? Did you know women pay 40% more? What will happen to the millions of seniors who will once again face the financial threat of the donut hole? What's going to happen to the thousands of children who will once again be denied health insurance coverage because they were born with a pre-existing condition? And what will happen to the young people on their parents' health care, unable to find work because Congress is not involved with that, or at least the majority is not? What will happen to them? Now, today's vote would take away health care from women like Nancy O'Donnell, who's 60 years old and lives in my district in Rochester, New York. She works 4 jobs to make ends meet, and not a single one of them offers health care. Her life changed when she was diagnosed with cancer and told she would need a mastectomy. With no insurance to help cover the cost of major surgery, she faced the very real prospect of suffering with cancer and having no hope of being cured. And if anybody out there believes that you can be diagnosed with cancer and not be able to get treatment for it because you have no insurance, you've got another thing coming. Prior to the Affordable Care Act, there would have been no recourse for a woman like Nancy. For years, millions of women and men in America were denied health insurance because cancer was a pre-existing condition, or if they had ever had it and they changed jobs and they had to get new health care, they probably would not be able to because they had had cancer. Even patients like Nancy, who had insurance, would, and she did not, remember, would face lifetime and yearly limits on the health care, meaning they would stop providing treatment because they didn't want her high-cost disease or affliction. But thanks to the Affordable Health Care Act, these tragic stories are no more. Thanks to the Affordable Health Care Act, Nancy was able to access health insurance at a price she could afford. And with that health insurance in hand, she was able to access treatment and found out that the mastectomy was no longer needed. She has now had 4 clean CAT scans and no sign of cancer, and we are all delighted for her. Women like Nancy are the reason I brought the Affordable Care Act from the Rules Committee to the House floor. Women like Nancy are the reason I stood up to those who threw a brick through one of my district office windows and who threatened my family because I wanted to provide affordable, life-saving health care to Americans in need, and also because health care was costing us 17, going on 18% of GDP, and we could not afford it unless we wanted to become the one industrial nation on earth that was only able to provide health care and do war. Surely to goodness, we would like to join the community of other nations. And in addition to that, we have put the burden on our employers to provide the health care for their employees that none of their competitors from overseas or Canada have to put up with. This has been really sad, and really the start of the debate for Clinton health care came from Lee Iacocca, who said that the cost of health care forced him to put about $2,000 more for the cost of each automobile he sold. It was unsupportable, but we're still at it here. The United States, as I said, is the only one that does not provide its citizens with safe and secure and affordable health care. They do it much cheaper than we do, with much better outcomes. But we put the burden back on the employers. That puts us at a disadvantage with competitors all around the world. But despite not providing reliable health care to millions of our citizens, the cost of health care rises. Prior to the Affordable Health Care Act, we were on a trajectory to soon be bankrupt simply through the skyrocketing cost of care. Since the presidency of President Roosevelt, and I'm talking about Teddy here, we're going way back beyond ahead of Franklin, numerous presidents have tried to provide health care. President Nixon, President Truman, President Clinton, to the millions of the uninsured to lower the cost of care. We, each of us, when we talk about having other people buy health insurance if they can afford it, and if they can't, we help them, each family is expected, and has been for some time, paying what is estimated to be between $1,000 and $1,500 more on your own health care to cover for the uncompensated cost of people who don't have it. So why don't we deal with this in a mature and grown-up way? Because somehow or other we can't. But the reason could be this. Yesterday morning, Politico, one of the newspapers that we have here on the Hill, reported on the plans of the majority over the next 4 weeks. They had been talking to members of the majority, and in part they wrote, quote, House Republicans have planned a series of hot-button votes over the next 4 weeks to contrast the party's agenda with that of Democrats and put President Barack Obama and Democrat candidates on the defensive as though we are not capable of standing up and defending the votes that we take. The main goal is to boost the party's prospects on Election Day. Madam Speaker, the record is clear. Today's vote is nothing more than a show. It is political theater. It puts political games ahead of the health of the nation's citizens. So on behalf of the millions of Americans who are already benefiting from the affordable health care, I urge my colleagues to change course and reconsider the legislation that's before us today. Frankly, we should drop it. There's no point in taking this vote at all. Too much needs to be done, from creating jobs to investing in schools, rebuilding our broken highways and bridges, and we have only been able in the United States to build one airport from the ground up since 1972 in Denver. That tells you how modernized we are. But we are playing politics with health care reform instead, and health care is already saving lives. So I urge my colleagues to oppose today's rule, the underlying legislation, and I reserve the balance of my time.
The gentlelady reserves. The gentleman from Texas is recognized.
Madam Speaker, thank you. At this time, I'd like to yield 3 minutes to the gentleman from Spring Hill, Florida, the gentleman from the Rules Committee, Mr. Nugent.
The gentleman is recognized for 3 minutes.
Madam Speaker, and I want to thank the gentleman from Dallas, my Rules Committee, a colleague, Pete Sessions, for yielding me the time. Over the past couple of years, I've met with thousands of people in the Florida's 5th Congressional District, whether it's businessmen, people on Medicare, veterans, and they all have the same appeal to me. Please, please repeal Obamacare. It's clear the American people know what our Democratic leaders still to this day don't want to admit. Obamacare eliminates millions of American jobs. It cuts hundreds of billions of dollars from Medicare, and it puts in place 21 tax hikes going to cost American people more than $800 billion over the next 10 years. And guess what? It only pays for 6 years of coverage. What a scam. Everybody knows that health care system is broken and reforms needed. But Obamacare is not the answer. Madam Speaker, I think a number of my colleagues forget that although the Supreme Court upheld the individual mandate because it's a tax, it did declare that parts of the bill unconstitutional. The court explicitly stated the Affordable Health Care Act is constitutional in part and unconstitutional in part. An expansion, they said, of Obamacare unconstitutionally forces states to extend or expand Medicaid. So the vote we take on this rule, H.R. 6097, gives members of this body two things: repeal a law that is in part unconstitutional, and repeal an $800 billion tax increase on the American middle class. I have to think if it's the other side knew that this was a tax increase back when they first implemented it, that, you know what, they probably would rethink their thought on it. Last night, my colleagues on the other side said that Obamacare reduces the deficit, but it's also a tax cut. Only in Washington does that work. Creating a new trillion-dollar health care program means reducing government spending. Only in Washington is $800 billion in new taxes a cut. These are numbers I know my colleagues on the other side of the aisle know, and more importantly, the American people know it. For all these reasons, I'm grateful to Leader Cantor for introducing the repeal of Obamacare Act, and I'm proud to be a co-sponsor of this legislation. I support the rule, I support the underlying legislation, and I encourage all of my colleagues who want real health care reform to do the same. With that, I yield back the balance of my time.
The gentleman yields back. The gentleman from Texas reserves. The gentlelady from New York is recognized.
I'm sorry, Madam Speaker. I am pleased to yield 3 minutes to the gentleman from New Jersey, the ranking member of Education Workforce Subcommittee on Health, Mr. Andrews.
The gentleman is recognized for 3 minutes. Without objection.
He really knows this.
I thank my friend from New York. It's great to be with her on the floor today, and my colleagues on the Republican side as well. Today we could be voting on a bill where we work together to cut taxes for small businesses to put Americans back to work, but we are not. Today we could be voting on a bill that would help cities and counties and states around the country rehire police officers and firefighters and teachers they've had to lay off, over 600,000 of them the last few years, but we are not. Today we could be voting on a bill that would say that if an American company brings jobs back from overseas, we'll cut their taxes and we'll pay for it by eliminating tax giveaways and loopholes for companies that outsource their jobs outside of the United States and take them overseas. But we're not voting on that. For the 31st time in the last 18 months, we're voting on a bill to repeal the health care law. Now, I know there are Americans who feel strongly for and against the health care law, but I think almost every person I listen to feels very strongly we should be working together to help create an environment where businesses can create jobs for the American people, not voting for the 31st time on essentially a political argument. Now, I do agree with my friend from Texas, and I agree with him. I thank him for mentioning my name. I respect him very much, about the need for facts in this debate. And there is one fact that I think we got to get to right away, which is whether or not the law that they are trying to repeal for the 31st time increases or decreases the federal deficit. The Congressional Budget Office, which is our neutral, nonpartisan auditor, said in January of 2011, the first time of the 31, when the other side tried to repeal this law, that repeal of the law would add $220 billion to the deficit. In other words, if you wipe the law off the books, the deficit goes up because of the spending restraints and the new revenues that are in the bill. And I would want to ask my friend from Texas if he can tell us what the effect of the repeal of this bill, in other words, if this bill passes, what will this bill do to the deficit according to the Congressional Budget Office? And I would yield to him.
From New Jersey yields to the gentleman from Texas.
I appreciate the gentleman asking the question. The gentleman also understands that the Congressional Budget Office has not, as a result of the Supreme Court, been able to render that decision.
Reclaiming my time,
The gentleman is
reclaiming, I would then respectfully ask my friend, why don't we wait and see what the auditor says the bill will cost before we vote on it? My understanding is that they're going to do that probably by the end of this month. Why don't we wait and see what the auditor says it's going to cost before we vote on this bill? And I would yield.
The gentleman from Texas.
Thank you very much, Madam Speaker. And I appreciate the gentleman engaging me. This really is of substance to the American people. The cost of the bill is twice now, we found out a year after it was passed, twice as expensive as it was originally started. And as a result of that,
the time has elapsed for the gentleman from New Jersey.
Okay.
And
my time is expired. Thank the gentleman. I would ask him on his own time. I'd be happy to engage him.
Gentleman's time has expired. For what purpose does the gentleman from Texas seek recognition?
Thank you very much, Madam Speaker. This time I'd like to yield to the gentleman from San Antonio, Texas, from the Financial Services Committee, Mr. Canseco. 2 minutes.
The gentleman is recognized for 2 minutes.
Thank you, Madam Speaker, and I thank the gentleman from Texas for yielding this time. And I rise in support of the rule and the underlying bill to completely repeal Obamacare. Though Obamacare has been found to be constitutional, it doesn't mean it is good for our health care nor good for our economy. And Obamacare is still a government takeover of health care, putting federal bureaucrats in charge of decisions that should be made by you and your doctor by creating 159 different boards, bureaucracies, and programs that will increase Washington's control over health care, like the Independent Payment Advisory Board, which is comprised of 15 unelected bureaucrats that will be empowered to decide what treatments Medicare will and will not cover. Obamacare also could lead to less access to care and lower quality health care. And I recently visited with several physicians last week in my district, and they told me that Obamacare could lead to a large exodus of physicians from active practice, leaving many Americans with health care coverage but without health care access. Obamacare also cuts over $500 billion from Medicare to pay for other spending, which could lead to physicians to cut back on the number of American seniors that will see and negatively impact their care by leaving seniors with health care coverage but without access to care. Besides being bad for health care, Obamacare is bad for our economy and I've visited with numerous small businesses throughout the 23rd Congressional District of Texas, and almost every one of them has told me that the biggest factor keeping them from expanding their businesses and hiring more employees is the uncertainty about the health care costs due to various taxes and mandates contained in Obamacare. Given the Supreme Court's ruling, it's now up to the people's elected representatives in the Congress to provide American families and small businesses with much-needed relief from the burdens of Obamacare by repealing it completely only after Obamacare is repealed. Thank you.
The gentleman from Texas reserves. Gentlelady from New York.
Madam Speaker, I yield 3 minutes to the gentlewoman from California, a member of the Committee on Energy and Commerce, Ms. Matsui.
The gentlelady is recognized for 3 minutes.
Thank you, Madam Speaker, and I thank the gentlelady from New York for yielding me time. Madam Speaker, I rise today in strong opposition to this rule and the underlying legislation. This bill marks the 31st time that the Republicans attempted to repeal the Affordable Care Act, and even though the Supreme Court of the United States has ruled it constitutional. Unfortunately, instead of focusing on job creation, here we are again. The underlying legislation exemplifies the majority's continuous drumbeat to abolish the ACA, fearful that Americans may have a chance to fully realize its tremendous benefits. Instead, the majority has only offered vague phrases and empty rhetoric, such as patient-centered health care, while repeatedly attempting to repeal legislation that will expand access to care for millions of Americans. Clearly, their idea of patient-centered health care refers only to those patients who can afford skyrocketing health insurance rates and do not have any pre-existing conditions. What is the point of patient-centered health care when only a small portion of the public can access the care? The underlying legislation before us today would deny my constituents and the American people the consumer protections for which they've been asking for years. This legislation would increase costs to families, small business owners, and seniors across the board. It would allow insurance companies to deny coverage to Americans with pre-existing conditions, drop coverage when people get sick, reinstitute lifetime limits on coverage, and charge people more based merely on gender. The ACA has already created long-lasting benefits for many of my constituents, including Paula, who in March of 2010 was diagnosed with Ewing sarcoma, a rare children's bone cancer, and given a 15% chance of survival. Initially, she was lucky to have health insurance, but an average of $60,000 per chemotherapy treatment, she quickly approached her lifetime benefits cap. These are not burdens anyone can or should have to bear. Because of the ACA, she remained covered and was able to complete her full treatment plan. And in the future, because of the law, Paula would not have to fear being denied coverage due to this pre-existing condition. It is time that we move forward and focus our efforts on job creation. I urge my colleagues to vote down this rule and vote against its underlying legislation. And I yield back the balance of my time.
The gentlelady yields back. The gentlewoman from New York reserves. The gentleman from Texas is recognized.
Thank you, Madam Speaker. At this time, I'd like to yield to the gentlewoman, a nurse, a health care professional prior to her service in the United States Congress, gentlewoman from Dunn, North Carolina, Ms. Elmers, for 1 minute.
The gentlelady is recognized.
Thank you, and I thank my colleague from Texas for acknowledging me, and thank you, Madam Speaker. I'm here today to join my colleagues and call on the immediate repeal of Obamacare with its massive tax increases. Last month, as we know, the Supreme Court verified that Obamacare is, in fact, a tax, one that has increased the financial burdens of every American by over $500 billion and will go down in history as the most significant expansion of the federal government and its power. This law has and continues to be bad policy for all Americans and future generations. The Supreme Court's decision has sent a direct message to Congress and policymakers that we have to get back to work to repeal this law and replace it with effective, efficient reforms. I have begun circulating a letter that will be sent to Senator Harry Reid, calling on him to allow for his colleagues in the Senate to have an up or down vote on the repeal. Every American needs to know how his senator feels about this as well. We each have an obligation to vote our conscience and carry out the business of the American people. I am encouraging all of my colleagues here in the House to sign on to this letter so that each member of Congress can decide whether or not they are in favor of raising taxes on millions of hardworking American taxpayers. Thank you, Madam Speaker, and I yield back the remainder of my time.
Time has expired. The gentleman from Texas reserves. Gentlelady from New York is recognized.
Madam Speaker, I'm pleased to yield 2 minutes to the gentlewoman from Maryland, Ms. Edwards.
The gentlelady is recognized for 2 minutes.
Thank you, Madam Speaker, and I thank the gentlelady from New York and join her in opposing the rule and the underlying bill. This is the way it's supposed to work. Passed by the House, passed by the Senate, signed into law by the President, and upheld by the United States Supreme Court. The ruling provided certainty for Americans and businesses all across the country, knowing that the popular provisions that they've already enjoyed are going to remain in place and we can continue to implement the law of the land. So, America, here's what Republicans want to take away from you today. They want to take away covering 7 million children, young adults, who can remain on their parents' health insurance plans until they're 26. They want to ban insurance companies from denying coverage to 17 million children with pre-existing conditions. They want to end tax cuts that benefit 360,000 businesses that employ 2 million workers, all provisions that have popular and bipartisan support. But rather than building on and moving forward from last month's ruling, nope, the Republicans, not surprisingly, decided to spend yet another day in Congress considering the repeal of the Affordable Care Act. 31 times that the House will vote on repeal. What a waste of America's time. 30 times that we haven't voted on jobs bills. 30 times we haven't focused on extending tax cuts for the middle class. And so for the American people in congressional districts all across the country, this is also the 31st time that the Republicans have put in jeopardy their access to quality, affordable, and comprehensive care. And so 250 million Americans could lose their benefits and protections with the vote today. It's a step backward for Marylanders like Doug Massick, who watched the Affordable Care Act because he couldn't afford to keep paying a third of his income for health care and had started using bags of coins to pay for his medicines. The Affordable Care Act saves Americans like him $4 billion. Families like the Mosbys in my county and Prince George's County, who suffered 3 traumatic health events and fell behind on their mortgage, almost lost their home. But the Affordable Care Act saves 105 million Americans who would reach lifetime limits but for the Affordable Care Act that the Republicans today want to repeal. It's time to get on with it. It's enough. It's time for Republicans to move on, approve the settled law of the land, and start to implement the law. And I urge my colleagues to vote down the rule and to vote against this repeal. And with that, I yield.
The gentlelady's time has expired, and the gentlewoman reserves. The gentleman from Texas is recognized.
Thank you, Madam Speaker. At this time, I'd like to yield 2 minutes to the gentleman from the Rules Committee from Brigham City, Utah, Mr. Bishop.
The gentleman is recognized for 2 minutes.
Thank you, Mr. Sessions. Thank you, Madam Speaker. If indeed this will be the 31st time we will vote to repeal what is commonly called Obamacare, that number signifies also the number of job-creating bills this House has also passed and sent over to the Senate. It would be nice if the Senate would actually deal on any of those issues to move us forward on all of these concerns. I do want to speak for just 1 minute here, though, about the concept of the 10th Amendment, one of the task forces of which I serve. You know, everything that we are talking about, there's nothing wrong with helping people provide for themselves. The issue always is, where should that decision be made? There's nothing wrong about that at all, but where did it be made? The brilliance of our Founding Fathers in coming up with federalism was simply the idea of choices should be made by people in the areas in which they can affect themselves. Massachusetts appears to have a health care system they impose upon themselves. They like it. That's fine. It won't work in the state of Utah because we are different. We have far more kids than Massachusetts does. We have a higher percentage of small business. Our solution is not their solution. And the brilliance of federalism is that the people who live in the states and the leaders of the states, they care as much as we do.
they also can decide for themselves as much as we do. And the other brilliance of federalism is states can decide to be wrong if they want to, without impacting the entire nation. There are some states that may want to have a robust government involvement and tax themselves to do it. Allow them to do so. There are other areas that want to have a less robust government. Tax themselves less. Allow them to do it. Only the states have the ability of becoming efficient, creating justice and creativity in their approaches. My state of Utah came up with a legislative exchange program that better meets the needs of my state, the demographics of my state. It is, in my opinion, still a better way of going, but unfortunately it is stopped by Obamacare. That is not what we should be doing. Not all great decisions have to emanate from this particular body. Now the Supreme Court has said this is a tax, fine. It must be enforced by the Internal Revenue Service. And we need to realize that there will be 12,000 to 17,000 new employees of the Revenue Service to enforce this provision. Will they be outsourced, as the IRS has done in the past, and does that prevent problems for it? Or will they be funded in-house, which costs us
Gentleman's time is expired.
I appreciate it, Madam Speaker, and I realize there is even greater cost still to come, and I appreciate your time.
Gentleman's time is expired. The gentleman from Texas reserves. The gentlelady from New York is recognized.
Madam Speaker, I'm pleased to yield 3 minutes to the gentleman from Massachusetts who knows health care, the distinguished ranking member of the Committee on National Resources, Mr. Markey.
The gentleman is recognized.
I thank the gentlelady. The Affordable Care Act is now part of our nation's fabric of health care laws. Right alongside Social Security and Medicare now stands the Affordable Care Act. And yet, the Republicans keep trying to take away or take apart the benefits included in this law for the 31st time since they took over the House of Representatives. What we have here, Mr. Speaker, is a severe case of Republican reflux. Again and again, the Republicans keep coming up with harmful attempts to destroy all of the protections Americans have gained under this law. A Groundhog Day Republican reflux attempt to repeal this historic piece of legislation that helps every family in our country. Again and again, the Republicans keep choosing corporations over consumers. The side effects of this Republican reflux are serious. If the Republicans succeed, insurance companies could once again deny coverage because of pre-existing conditions. Kids with asthma, women with breast cancer, all of these protections would just go away, and the Republicans will replace it with nothing. Americans could once again be forced into bankruptcy just because they got sick. Just because they got sick, they could go bankrupt if the Republicans' repeal attempt is successful this afternoon on the House floor. And what are they going to put in the place of that protection against going bankrupt just because you are sick? Nothing. They have no proposal to have something replace those protections for American families. Women could once again be discriminated against with higher insurance premiums. Just being a woman, unfortunately, under existing law, is a condition which has women paying more. What are the Republicans going to replace this protection for women that is now in the law? Nothing. They have no proposal they're bringing out here today onto the House floor. With this Republican reflux, it's the American people who get burned. All they are doing is bringing out a proposal to repeal protections that ensure for every American family all of these extra protections which the Republicans have always denied them. And they keep saying, oh no, we care about pre-existing conditions. Oh no, we care about people going bankrupt. Oh no, we care about women being discriminated against. And then you say to them, well, where's your proposal? Bring it out here. Let's have a vote on it. But you know what? This is about insurance companies over the consumers of our country. Vote no. on this Republican reflux
The
bill.
gentleman's time has expired. The gentlelady reserves. The gentleman from Texas is recognized.
Thank you, Madam Speaker. At this time, I'd like to yield 2 minutes to the gentleman from Knoxville, Tennessee, the gentleman, Mr. Duncan.
The gentleman is recognized for 2 minutes.
I thank the gentleman for yielding, and Madam Speaker, I rise in support of the rule and the underlying legislation, the so-called Affordable Care Act, which should be called the Unaffordable Care Act. Even if the President's plan was the best thing since sliced bread, we simply cannot afford it. Both Medicare and Medicaid now cost many times more than what was estimated when they were first passed. Already, the estimate for the President's plan is double what it was just 1 year ago, and most of it will not be fully implemented until 2014, and some parts until 2016. And much of it is, quote, paid for by placing millions more onto the Medicaid rolls. This will cost all the states many billions they do not have. The nonpartisan Congressional Quarterly estimated these additional Medicaid costs at $627 billion over the next 10 years. In addition, the Joint Committee on Taxation in June estimated that increased taxes over the next 10 years just to cover the plan would be from $675 billion up to possibly as much as $804 billion. If these are low-ball front-end estimates, as is typical, the health care plan will not work unless medical care is limited or restricted more and more each year. In considering their vote on this legislation, this so-called Affordable Care Act, I hope that my colleagues will consider these strong words by Dr. Milton R. Wolf, President Obama's cousin. He wrote this. He said, "For the first time in the history of our republic, our government has demanded that every American, upon the condition of breathing, be forced to enter a legal contract with government-approved corporations. Not even King George III dared impose such control. In truth, if a government can force you to patronize companies of its choosing, the fundamental relationship between the government and the individual is irrevocably changed. If it is allowed to stand, there will be no part of your life the government cannot control, and no crony it cannot enrich with your money." I urge support for this rule and this underlying legislation. I yield back the balance of my time.
The gentleman yields back. The gentleman from Texas reserves. The gentlelady from New York is recognized.
Madam Speaker, I yield 2 minutes to the gentlewoman from New York, my colleague, Ms. Maloney.
The gentlelady from New York is recognized for 2 minutes.
I thank the gentlelady for yielding and for her leadership. Mr. Speaker, today Congress must once again spend time in an empty gesture, even as this country waits for real solutions to serious problems. Instead of dealing with ways to spread and expand the creation of jobs, once again our colleagues on the other side of the aisle insist that we pretend like we're going to repeal the Affordable Care Act, even though that could drop over 6.6 million young adults under the age of 26 off their parents' health care policies, even though that could throw 17 million children with pre-existing conditions to the mercy of the marketplace, even though that would drop 5.3 million seniors down the donut hole of Medicare, even though it would just create new uncertainties for small businesses, even though all of this is true and more, you make Congress once again engage in this crude kabuki which is totally without meaning. Because if by some dark miracle you were able to pass the bill in the House and the Senate, do you believe for 1 second that the President would sign it? So what are we doing today? Taking a vote on repealing the Affordable Care Act for the 31st time. It was a waste of time the first time, the second time, the third time, and so on, and it's a waste of time today. So I would say let's just hurry up, vote no on the rule and the underlying bill, and let's get back to the business of working to create jobs for the American people.
The gentlelady yields back. The gentlelady from New York reserves. The gentleman from Texas is recognized.
Thank you, Madam Speaker. At this time, I'd like to yield 1.5 minutes to the gentleman from Savannah, Georgia, Mr. Kingston.
The gentleman is recognized.
Thank you, Madam Speaker. There's 5 quick reasons why I think this bill should be repealed. Number one, it does not decrease the cost of health care. In fact, it is estimated that it will increase costs by 13% per family and is already moving towards $2,100 increase. Number two, the loss of health care. The nonpartisan Congressional Budget Office estimates that 20 million people will lose their employer-based health insurance because of the mandates in Obamacare. Number 3, it interferes with the patient-doctor relationship. The law creates 159 new boards, offices, and panels within the federal government to be in charge of people's health care decisions. Number 4, increased government spending at a time where we borrow 40 cents on every dollar we spend and our national debt is 100% of the GDP. Obamacare is expected to cost over $1.8 trillion over the next decade. We don't have the money. And number 5, loss of jobs. The nonpartisan Congressional Budget Office estimates that nearly 800,000 jobs will be lost because of Obamacare. Madam Speaker, we need to repeal Obamacare and replace it with the best ideas of Republicans and Democrats, which should include expanded health savings accounts, ending frivolous lawsuits, association health plans, across-board, across-state lines health care purchases, and state-run high-risk pools. These ideas will bring America together rather than divide us as a country over this very important issue. And I yield back the balance of my time.
Time has expired. The gentleman from Texas reserves, and the gentlelady from New York is recognized.
Madam Speaker, I yield 2 minutes to the gentleman from Texas, a member of the Committee on Ways and Means, Mr. Doggett, who also served on Subcommittee on Health during the health care debate.
The gentleman is recognized.
I have lived through a terminal illness while struggling to get well and struggling to get and keep my insurance. I've been denied insurance because of a pre-existing condition. I have lived this. It is very real for me. Today I breathe a little better. Life is good because now I have hope. That was the reaction of my constituent Aaron Foster to the approval of the Affordable Health Care Act by the Supreme Court. And today's legislation ought to be called the Take Away Aaron Foster Hope Act, because that's what it is, replacing the Affordable Health Care Act with only tax breaks for Tylenol. In a few days, thousands of Texans will be receiving checks of almost $200 each, almost $200 million in rebates from private insurance companies that overcharged and abused them. This bill should be called the Return to Sender Act, because it says those abusive health insurance companies get their money back if this act became law. There are seniors today who are trying to make use of the flawed Republican Prescription Drug Act that is now law. They left a giant gap, sometimes referred to as a donut hole, in the coverage of that act. Our seniors, as a result of the Affordable Health Care Act, have seen their prescription costs go down and some of that donut hole plugged, eventually to fill it all and provide them the protection that they have earned. This bill, if enacted, would double the cost of prescription drugs for those in the donut hole. About 2.25 million Texas seniors would also no longer receive free preventive services. This act should be called the Charge Seniors More for Their Prescription Act, because that's what it does. You see, the problem is that in their near fanatic determination to see that President Obama fails on everything, Aaron Foster and that senior and that individual that is counting on one of those rebate checks, they're just collateral damage to these Republicans. Do you have another 20 seconds?
Oh, I'm sorry, I don't have it.
I yield
back. The gentleman's
back.
time has expired. The gentlelady reserves, and the gentleman from Texas is recognized.
Thank you, Madam Speaker. Madam Speaker, at this time I would like to extend to the gentleman from the Foreign Affairs Committee, one of the most influential committees we have here in the House of Representatives, the gentleman from Laurel, South Carolina. 1 minute to Mr. Duncan.
The gentleman is recognized for 1 minute.
Thank you, Madam Speaker. Americans know that the government takeover of health care is wrong. They spoke very loudly when the other side of the aisle forced this on America in the last Congress. It was bad policy before the Supreme Court ruled. It was bad policy in January when we first passed the repeal bill. It's bad policy today, and it will be bad policy tomorrow. $500 billion away from Medicare puts government bureaucrats between Americans and their doctors. It rations care for the American seniors. It adds exponentially to the nation's debt. it grows government. Specifically, it grows the Internal Revenue Service to collect the tax, which the Supreme Court of the United States so evidently pointed out that it is a tax that will be assessed if you fail to meet the government's requirement to buy something. Socialized medicine is wrong for America, and it is time to repeal the bill. And with that, I yield back.
The gentleman from Texas reserves, and the gentlelady from New York is recognized.
I am pleased to recognize for 2.5 minutes Mr. Pascarell from New Jersey.
The gentleman from New Jersey is recognized.
Thank you, Madam Speaker. How are you doing today? Albert Einstein once said the definition of insanity, and you've heard this before, Madam Speaker, is doing the same thing over and over and expecting different results. Well, we've already voted over 30 times to repeal or restrict the Affordable Care Act. And here we are again, what I consider wasting time with politics instead of putting people back to work. We are offering you the opportunity to help your constituents right now, Madam Speaker. You could defeat the previous question and take up the Bring the Jobs Home Act, which for the first time makes sure we promote insourcing of jobs and stop the corporate welfare for outsourcing jobs. In the last decade, we have lost 5.5 million manufacturing jobs and 1.3 million back-office jobs. However, we have seen that the light of our economic recovery is powered by domestic production, not outsourcing of jobs. And we've added almost 500,000 manufacturing jobs in just the last 2 years. There are some who think outsourcing is a good policy. And in fact, they have made hundreds of millions doing just that. I believe the American dream starts by creating good jobs right here in the United States, and that we should not outsource the American dream to China or any other country. This bill is very simple here. We're going to end the tax breaks that encourage companies to ship their jobs overseas and use that to pay for tax credits for patriotic companies that want to bring jobs back home. That's pretty simple. So why are we wasting our time, Madam Speaker? With all due respect. The Supreme Court has ruled the Affordable Care Act is the law of the land. If the law is repealed, according to a report by the New Jersey Public Interest Research Group, employers would see health care costs grow by more than $3,000 a year. Premiums would be increased from 14% to 18% per year, higher to those who want to buy insurance. And my home state of New Jersey would have 10,000 fewer jobs by the end of the decade. Despite the rhetoric, the majority has yet to propose a replacement that will cover all the people that want to throw off the health care roll. They want to throw off the health care rolls. Can I have 20 seconds? 10 seconds.
10.
10 seconds.
The gentleman is recognized for 10 seconds.
And they continue to ignore the #1 priority of the American people, creating jobs. A week after the 4th of July, Madam Speaker, I urge my colleagues to defeat this motion. Let the House vote on a patriotic American bill
Fired, the
that
gentlelady
will create
reserved,
jobs right here. Thank
and
you,
the
Madam
gentleman
Speaker.
from Texas is recognized.
Thank you, Madam Speaker. Madam Speaker, at this time I'd like to yield to the gentleman who, before he came to Congress, was on the front line of health care as an anesthesiologist in the Eastern Shore of Maryland. I'd like to yield to the gentleman, Congressman Harris, 2 minutes.
The gentleman is recognized for 2 minutes.
Thank you very much. Thank you very much, Mr. Chairman, for yielding the time. Madam Speaker, my. Former Speaker Pelosi was so right when she said Congress had to pass this bill so Americans could just find out what's in it. Well, Americans have learned a lot since we first tried to repeal the President's Health Care Act last January. We learned that it still continues to stifle job growth, and we learn more and more about it. And that's why we have to attempt to repeal once again. Earlier this year, Americans discovered that the law creates a new nationwide mandate for coverage that doesn't allow people to opt out when they have a religious or moral objection to those covered services, a violation of the Religious Freedom Restoration Act, duly passed by this Congress, and more importantly, a violation of their First Amendment rights. These inflexible mandates jeopardize the ability of institutions and individuals to exercise their rights of conscience, one of the most basic rights. And yes, we discovered this since we voted on the repeal last January. So, Mr. Speaker, by now Americans have learned enough about this bill. They want it repealed, and we should listen to them. We should pass the rule and pass the bill. I yield back the balance of my time.
The gentleman from Maryland yields back his time. The gentleman from Texas reserves. The gentlewoman from New York is recognized.
It's vicious and spiteful.
I reserve.
Gentlelady reserves her time. The gentleman from Texas, Mr. Sessions. Thank you very much, Mr. Speaker. This time I'd like to yield 3 minutes to the gentleman from California, the chairman, Rules Committee Chairman, the gentleman, Mr. Dreyer.